There are many cosmetic problems people come to see me with, and one of them is a gummy smile. We've all seen those people. They might have perfectly healthy and formed teeth, but when they smile at you, all you see is their gums. People often live for years thinking that there is nothing that can be done. However, that's not necessarily the case. We do have options. The important thing is to evaluate whether the gummy smile is a result of overgrown gums or overgrown jaw. When there is too much soft tissue, the gums and the underlying bone can easily be contoured. This procedure is called crown lengthening, and it improves the appearance dramatically. It is a fairly straightforward procedure. It takes maybe an hour or just over an hour at the dentist, and it takes 3 months for the gums to heal and settle in their new place. However, an overgrown jaw is a much more involved and serious problem. This problem is naturally more involved to treat. It requires orthodontic surgery, and as you would imagine, recovery from such surgery is more involved and lengthy. However, in the long run, it's well worth it. With crown lengthening, it's a fairly straightforward procedure. It usually takes a single visit to the dentist. The healing is fairly uneventful. It maybe takes an hour or so to do. Literally what the dentist does, he or she trims your gums and, if necessary, the underlying bone. It's done under local anaesthetic. It's fairly painless. Sometimes you have to have some fairly small stitches in your gums for a week or so, but they're not too big, they're not too obvious, and healing usually happens uneventfully. With the second procedure, which is called maxillary impaction, which is a surgical repositioning of the jaw, it is much more involved. You usually have that done in the hospital under general anaesthesia. Healing also is fairly painless, but there is usually a lot of swelling, and the recovery time is a lot longer than with crown lengthening. The second option is usually done with orthodontics. It is very rare that jaw surgery is done on its own without a follow-up orthodontic treatment.